Hi, welcome to part 2 of our special care nursery central line tubing change procedure. First, I want to show you our supplies that we've gathered here. Before you begin though, we want to perform proper hand hygiene before patient and equipment contact. And then we want you to clean your preparation surface first, and then don your hat and mask and assemble your supplies. You'll see we have this new laminated reference card for you that's located on all of the IV pumps, and I've put one at the bedside here to kind of assist me in my procedure. This has all the supplies that you'll need. We'll start off with our IV fluids that come from pharmacy, any IV syringes you will need for your medication line. I've used this to show our lipid tubing, our lipid syringe. And then next on the list is our IV fluid tubing. And then our IV filters and our lipid filters. So the first one I'm showing here is our IV or TPN filter. And again, you notice this one because it has the blue clave. And it's also the smaller micron, the 0.2 micron. A lipid filter. Again, the lipid filter does not have the blue clave, and it's a bigger micron, a 1.2 micron. And if you think of it as lipids being thicker and fatter, they need that bigger micron to be able to move through the filter. Next up, you're going to have your claves, and I have 4 of them for a standard tubing change that would be like TPN lipids with a inline medication line. Then we're going to have our bifuse, or we can also refer to this as our Y port. We're going to have some betadine wipes, alcohol wipes, and then your medication microbore tubing as needed. And this is the tubing we will use for our lipids and also for our medication line that we leave in place. Then we're going to have 2 packs of sterile 4x4s. And then 2 pairs of sterile gloves. You can also at this time get your IV change labels, and then also your fluid identification labels that we talked about in part 1. And you can have all of those ready for after you prime your fluids. Now that we have all our supplies, I'm going to move my table close to the bedside and kind of move my IV pump towards me, so that it'll make it easier when I'm changing my tubing. So to start, I'm first going to hang my bag, my IV fluid bag from the pharmacy. I'm going to go ahead and hang that, and I'm going to remove the cap. And next, I'm going to open my sterile gloves, and I like to make a little area for myself to kind of work here. And you see, you can leave your tubing change procedure right here so you can follow it along as you go. So I'm going to open my sterile gloves, and I'm going to use this wrapping as a sterile field on my table. So again, just kind of make yourself a little work area. Next, I'm going to start opening my supplies onto the sterile field. Now, some of these are already open, so let's just go with suspending disbelief that these are sterile that I've opened. Okay, so I'm opening my IV tubing, and we're going to simulate that that is all on the field. Next, I'm going to open my TPN filter, my lipid filter. I'm going to open up all my microclaves, and again for this type with TPN and lipids and a medline, I'm going to need 4 of them. And my bifuse or my Y port. Okay, and then I'm going to open up my medline tubing and my lipid tubing, which again is the same microbore tubing. Then I'm going to need my 2 packages of my 4x4 gauzes, and you can kind of to rearrange these once you have your gloves on. And I'm going to reserve one of these packages because I'm going to use this later to put underneath my clave when I'm doing my dressing change. Okay, so now we have all our supplies open on our sterile field. The next thing I'm going to do is remove the caps that come on my syringes, and this is my lipid syringe, and I'm going to position these so that the lure lock portion of the syringe is on the sterile field edge. And then remember, our saline flushes that we take out are not sterile, so we don't want to put them onto a sterile field. I'm going to remove the cap, and again, I'm going to put that on the edge of my sterile field. Okay? Next, we're going to open our alcohol and betadine, and you can open up a couple of them. I only needed to use one of each in this procedure. And then I'm going to kind of place these on the perimeter of the field as well. Okay. And then next I'm going to don my sterile gloves. And then that other pair of sterile gloves, again, is for use later, that I'm going to keep on the side. Okay, and now at this point, I'm going to assemble my claves onto my Y ports and attach my tubing and my filters. So whatever way works kind of best for you. I think how I like to do it is I'm going to first take that bifuse connector, and we have to put 2 claves on here, although it kind of looks like there's one there. We're going to actually attach, and I can just put my garbage on the side or put it on the field. So this bifuse needs a clave put on both sides there. Okay, so 2 claves are going to go onto that bifuse there. And then next I'm going to do my TPN. So I'm going to close my roller clamp. And then I'm going to find the end of my tubing, and I'm going to attach that TPN filter. Remember, that's the 0.2 micron with the blue clave. So I'm going to attach my TPN IV fluid filter. And then now this is going to attach on one of my bifuse claves. And again, it doesn't matter which side you use. Okay, so we have that all together. Okay, I'm going to attach my lipid tubing to my lipid filter. Remember, again, that's the larger micron, the 1.2 micron. And I have my clave here at the end that's going to go to my syringe. So then I'm going to connect my filter to the other clave that's on the other end of the bifuse. Lastly, I'm going to do my inline medication tubing. And again, we want to leave these med lines in line for that 96 hours. So just like the IV fluid tubing, the med line is also going to stay in line for 96 hours. And then here, there's 2 options. You could attach another bifuse here if you wanted, but we have this clave right here, which is located below the filter. And so I like to put my med line right there, and it's coming off the TPN line, but it's below the filter, so we're okay with that. All right, so now we have everything closed there. I'm going to close my Y port slides. Here's where I will grasp my syringes using a sterile 4x4 to attach to the clave on the end of my lipid tubing in my med tubing. I'm going to take one of my sterile 4x4s, And I'm going to grasp my lipid syringe, and I'm going to attach that to my clave at the end of my lipid tubing. And then I'm going to use the table, and we're imagining we got our white lipids there, to prime through my lipids, through my filter, to the end of the clave. And then I'm gently going to put my syringe down back on the table. Okay, next I'm going to take another sterile 4x4, and I'm going to grasp my saline syringe, and then I'm going to put that on the end of my Medline tubing. There we go. Again, using the table to flush the tubing with the saline all the way to the end of my bifuse connector. And once I have that flushed, then I can gently lay my syringe back on the table. Okay, so now our next step is we're going to put the tubing aside, and we're going to now spike our IV fluid tubing, or your TPN, with the bag. So we're going to take another one of these sterile 4x4s, which is going to allow me to grasp the bag, and then I'm going to spike that. Kind of get this out. I may need to move my table a little bit with my foot there. Okay, so then I can grab my bag, make sure I'm not going to lose anything, and then I can spike my bag. Okay, and fill my drip chamber half full. Okay, and then my tubing is connected there. Okay, using a second RN, we're going to place that protective barrier that we kept from earlier between the bed and the central line clave. And then we're going to disconnect the tubing. Now we're going to vigorously scrub the central line clave, including that connection if you need to change this after 8 days, with betadine times 30 seconds. And this is a different practice than we've done before. So the important part is we're vigorously scrubbing this for 30 seconds. All right, so let's say that was 30 seconds. And then we're going to allow a dry time of 3 minutes. Okay, so we'll watch our clock while we're doing that, and we're going to allow 3 minutes. When that 3 minutes is up, we're going to vigorously scrub the same clave now with alcohol for 15 seconds. And then we're going to allow that to dry. At this time, we're going to grasp our last sterile 4x4, and we're going to invert it, and we're going to place it under that scrubbed clave that you can place down at this time. At this time, we're going to don our new sterile gloves. So that we can connect our new tubing to our clave. And then you'll have your second RN with you to be able to then verify our fluids, our tubings, and do our tracing from the site of origin to the pump, making sure that we have all of our tubings labeled at our bifuse connector, and that we also have our medications and our IV tube change stickers all on our new fluids. Okay, at this time, I'm going to connect my tubing to my clave. Okay, and now we're complete. And now we can take our old tubings out, put our new tubings in the pump, again verifying with that second RN, tracing our fluids from site of origin up to the pump, verifying our rates, and at this time we would be done with our central line tubing change. Two final reminders, just to clarify, we standardized our practice, so we do have an IV filter on all IV fluids, so that includes peripheral lines, our PIVs, so those will also have your TPN or your peripheral IV filter, so all of our fluids are now filtered, clear fluids, TPN, and lipids. And also as a safety measure, save the hemostats that they use when they insert the lines. It's really important for our central lines that we have at least one hemostat per line at the bedside, just in case there was an accidental dislodgement or something. We would have that for emergency purposes. So make sure that you have a hemostat, one for each line at the bedside in case of emergency. Thank you.